So thank all of you for being here. And as of today, we have 3,489 positive cases of the coronavirus in Albany County. 1,132 people under mandatory quarantine. That's an increase of 16 positive cases overnight. As I said yesterday, we had 24, and the day before that, we had 24. Of the new positives for today, we know 8 had close contact to positive cases. 2 are healthcare workers, and 1 person had reported traveling, and 5 didn't have a clear source of infection. 15,712 people have now completed quarantine. 3,334 tested positive for the virus have recovered. That's an increase of 11 people as of yesterday. Some of the things that we told you we keep tracking through the control room meetings we have with the state, once a week now we're kind of down to, are the 17 people currently hospitalized with a hospitalization rate of 0.48% of those who have tested positive. Yesterday that rate was 0.40. We're seeing a really uptick in hospitalization, not just here in Albany County, but across the Capital District, across the state. So that's one thing we have to continue to monitoring. And I said yesterday, we're trying to figure out how long they're staying in the hospital versus last time. Like I said, a week and a half ago, I had a family member that unfortunately got the COVID-19 and still is in the hospital a week later with the same problem. So you're seeing that hospitalization with certain people staying in there longer. So that's something that we have to start to continue to address as we move forward. 2 patients currently in the ICU yesterday. That's a number. That number was 1. Over the last 5 days, we've seen an average of 24.4 new positive cases each day. Yesterday it was 28. We continue to tell people to do the right thing. Please wear a mask. Cough into your arm. Clean your hands. Socially, stay 6 feet away is to the best of your ability, and continue to do the right thing. I know we went through it yesterday. I don't want to sound like a broken record. It's not gone. It's not done with us. We need to continue to be vigilant. We need to continue to do the right thing. And I imagine Liza will talk about you need to do the right thing and be honest with the people that are working the epi department and doing the mapping and tracing, because it only helps us stop the spread or identify where it came from, so we know what the clear source was, so they can mark it off. It only helps everybody for you to be honest. If they're not there, you're not going to jail, you're not getting fined. These are just things that help us in this type of health crisis do the right thing, and we need you to continue to do the right thing, but to be honest with us. So again, there's plenty of places to go to get tested all the time. We continue to tell that. You can go to Albany County's website to get the complete listing of every place in the county that you can go to. Please, it's all free. It doesn't cost you anything. Your insurance shouldn't even be charged. But if it is, it should be free. And there's a lot of variety of spots that you can go to get it done, especially with people with smaller children. Just continue to go to our website and other places, UAlbany, Whitney Young, and all that, and to get it done. But over the last month, we've been hearing reports across the state and the county about how coronavirus has been making mental health and addiction issues even worse. Especially a lot of people with addiction issues in the beginning when everyone was quarantined, doing the right thing, staying home. These men and women rely on these services, but rely on meeting together, and sometimes it's just leaning on someone's shoulder to really get them through the addiction, because even though someone might have been sober for a year, might have been sober for 20 days, might have been sober for 11 years or 12 years, it's a struggle every day for people with addiction. It doesn't go away, people. It's tough, and I commend my 2 brothers constantly. One's been sober 20 years and the other one's been 12. And they still struggle at times because it's tough, and hopefully you don't mind me sharing that, but I'm damn proud of them because of where they worked to where they are today. But it is a struggle, and it's a struggle for people to get together. So, unfortunately, we've seen a spike in overdose deaths, not just here in Erie County. I was talking to Mark Polenkartz out in Erie County, Steve McLaughlin in Rensselaer County. Steve's been on this, talking about this, the impact it's having on people's mental capability, as well as the overdose, including Marcus. I was talking in Dutchess County, Steve Newhouse, Mary Ellen O'Dell. I could just go through it. It's just not us. Everyone's seeing this. And again, as you see this health crisis going on, economy crisis, there's things that we still need to do to reach out to continue to do our job. So there was a glimmer of hope that maybe here in Albany County it wouldn't be spread, but from that time, we sadly have reports have shown that we're not immune to what's going on around the state of New York. So tragically, we lost 72 Albany County residents to overdose within the first 9 months of the year. 72 since it started. Over that same time period, 2019, there were 50 overdose deaths. That's up 44%. 44%. In 2019, we had 62 deaths. So far already, we have 10 more deaths this year than in all of last year, and we're not done with this year. So one of the things when I was with Sheriff Apple on Sunday and we were driving around looking at the polling places and some other stuff, we talked about the effect that this is fentanyl, that people are using in cocaine now and other drugs, that the effect it's having on and being shut down, the effect that it's have. And if you look back just to 2018, we had 55 overdose deaths. So you can see how this effect has had on people, and that's why, like day 2, we set up the mental health hotline for people to call, because people deal with stress differently. And I've said this to this, I don't want to speak for Dr. Whalen, but I know her stress level is a lot higher than most other people because of what she deals with, not just being a doctor, but running the health department. The same thing with Dr. Giordano, running mental health. But someone in their life, and like my life, we're used to the high-end pressure that we get all the time. We take it in strides and we learn how to live with it. But there's people in our own families or households that can't, that a little thing gets them upset, and we have to walk them through it. So again, you just got to take that step back and deep breath and remember, not everyone reacts the same. But we've had more overdoses in 2020 than any year over the last 5 years. And considering the time delay in getting toxicology screening from the coroner, the numbers for this year is likely even higher because we're still waiting for a lot of that stuff to come back. There are a number of things that can contribute to the increased these overdose deaths, and that's social isolation during the quarantine, economy uncertainty for a lot of people, and mental health, and a variety of other things that can contribute to everything. So, these are things that we continue to look at, the difficulty of getting the recovery and prevention services people need during the shutdown. We realize that. There are plenty of other reasons that are likely influencing what we're seeing, but one of the overreaching factors is the presence of fentanyl. It shows up in 88% of those who died in 2020. For those who don't know, fentanyl, it can be 50 to 100 times more potent than heroin. It can kill you. It can kill you in a heartbeat, especially those with low tolerances, which people don't realize. And while we often see heroin laced with this stuff, increasingly it's being found in cocaine and in meth. With that being said, we need to take things and make things different and educate and continue to tell people what's going on with everything going on. But we still continue to offer things like our opiate overdose prevention training each week via Zoom, which is different. Like I said, Zoom works for some people. People love to be in person, again, because sometimes just medicine's working. In certain cases, it's not going to work because people like to be with somebody in the room and talk to them one-on-one. Some of the other things that we're doing differently, we just scored a victory after receiving nearly $900,000 for Revamp LEAD. The program to ensure those with mental health and addiction issues aren't just thrown into jail, but rather diverted towards services that will help them get back on their feet. So I want to thank everyone involved with that and what we continue to do to revamp that whole program and continue to do the services in the community. Like I said, Sheriff Apple and I had a lot to talk about on Sunday, and a lot of this has to do with the programs that we're running and the things that we can do differently for the people. How is it affecting people going forward? So I have Dr. Giordano, our Mental Health Department Director, and Dr. Whalen here. They're the co-chairs of the Albany County Opiate Task Force that we created to bring together local community leaders who work on the crisis, build upon current work being done, talk to the ministers in the neighborhoods that see people firsthand, talk to their families, get people in there, unfortunately, that have lost family members or friends of theirs, relatives of theirs, to this awful disease, to come and to mentor, to talk to other people, to also work with the police agencies, and they've been doing this for a while, and I know a lot of police agencies get a lot of different flack, but this is something they've been involved with, the chief of Albany, Bethlehem, Colony, I could go on throughout Green Island. They're all involved with this because they want to make a difference. No cop or EMT or fire department wants to roll upon a scene and have to do a reversal. So these are things that we talked about in the different tools in the arsenal to not just help with this public crisis, but to help educate people and to train them. And unfortunately, we've been training people, had administrated drugs and different things to help reverse things like this. But we want to continue to keep this number lower, and we need your help. And we need people out there to reach out to people, and that's what I said. Even with our suicide rate so high, just call someone up. And trust me, somebody that this has happened to time and time again, and continues to happen with. You can beat yourself up, but make that phone call, send that text. Just say, hey, how you doing? Hopefully everything's good. Do you need me? Do you need to talk to somebody? And be there for that person. But again, I want to hand it over to Dr. Giordano to talk about what's going on with this task force and the stuff they continue to work on with everything and the programs that we have out there. Dr. G.
Thank you, County Executive. Good morning, everybody. Those remarks were quite accurate. We're in the midst of as some people have characterized, a epidemic within a pandemic. I don't know that we could have dreamed this up last year to be any worse. But I would like to give you some hopeful comments, put some perspective around this. But also be reality-based, because we have some very serious concerns that we're facing. I think the first thing I'd like to start with briefly is to give you a sense of the magnitude of what is going well in Albany County. At the present time, today, there are more than 2,600 individuals in Albany County receiving addiction treatment. That's a big number. I hear it all the time. I'm used to it. I don't know if you all know that. But there's 2,600 folks that are in treatment. 1,500 plus are struggling in their recovery with opiate use, abuse, and dependency. So why is that hopeful? Well, that's hopeful because 1,500 people didn't die of an overdose today. And those people are, as the county executive said, working very hard in their personal lives to manage all the stress that we're all dealing with, in addition to struggling with their efforts to stay sober and to remain in recovery. So I think we should be encouraged by the fact that there are so many people who are getting help and who are moving towards a healthy living. Unfortunately, that's also a very disturbing set of numbers. 2,600 people in treatment, 1,500 receiving treatment for opiate addiction, and despite those large numbers of people whose lives we're touching, hopefully in a positive way, we lost 72 people so far in this year. I've been here a couple of times over the last 7 or 8 months, and we talked in the beginning about the factors that were lining up, the confluence of factors that were lining up that were stressing even the healthiest of those in our population. There aren't many of those left because we've all been enduring this strain. But for those people who have addiction and mental health issues, the enduring uncertainty and anxiety, the losses associated with losing loved ones, losing one's job, all of those things have been a confluence of negative factors that have worked together to make living with addiction even more difficult than it would have been otherwise. So the reality is that these are very disturbing numbers that the county executive mentioned, and but I would like to steer it again towards a hopeful message, and that is that we know treatment works, we know recovery is possible, and we know there's help out there. And we have been giving you numbers that are available for people who are in need of help, and I'm sure we'll give them again. I don't know if they're going to be up on the screen, but we'll give them to you. Our county programs, the state programs, our emergency numbers. We need to have people engage with us so that we can try to move them into a healthy recovery. But the hope is there. One important factor is that even though there are 1,500 people receiving opiate treatment, over 85% of those people are receiving evidence-based, science-based, medication-assisted treatment. And why that is important, I can only tell you I've been following this in this county for the last 10 years, and these numbers have totally reversed. We started out where it was rare to get that kind of science-based, evidence-based, medication-assisted treatment. 85% of the folks who we are able to engage and keep in treatment are receiving that care. That's remarkable, and I think that's something to be hopeful about. We are, a few years ago we started our open access, Capital Region open access treatment engagement program. We've touched 700 people's lives in the last 2 years with our partnership with Catholic Charities and the Addiction Care Center of Albany to bring people into treatment. So the reality is that there are some disturbing trends that we need to deal with. The hopeful factors are that this county is rich in services. There's treatment on demand. We have a lot of people who are standing ready to help, and the reconvening of the opiate task force, I think, is a great step, because it was premised on the idea that no single hand can fix this problem. And so we brought public health, law enforcement, mental health to the table. And our mission is through cooperation, integration, and collaboration, we can fight this, and we have to continue doing that. So I welcome the opportunity to work with Dr. Whalen moving forward on this, and our community partners. We have work to do, but I think we're up for the task.
Thank you, Dr. G, as always, and to Dr. Whalen, which gave a glimmer of what she does day in, day out in the Department of Health through this COVID-19, but that's not all she has to do. There's a huge responsibility of our health commissioners here in Albany County, across the state of New York, a variety of issues that they have to be involved with, and so it's kind of nice to highlight the department on what you do under your leadership day in and day out, where a lot of people go on with their daily lives and don't realize that. But thank you for co-chairing this opiate task force and making a difference in people's life. But Liza.
Thanks very much, County Executive McCoy, and it's really good to be here with Dr. Giordano as well, who I have the great pleasure to work with on many issues. As those of you know where we're located, our departments are co-housed in 175 Green Street, so we have the opportunity to collaborate on multiple different fronts, but particularly on the opioid issues that the county and the nation face at this time. I believe it's important to have a partnership with mental health and public health so that we can utilize strategies from each of our backgrounds to tackle, as Dr. G mentioned, an epidemic within a pandemic. We know from a public health perspective that prevention is essential. And, in addition to all of us here leading departments, we're all parents at this table, and all of us have children that at one time or another we've had to have these conversations with. And the first thing that I want to do is let parents know that there are a lot of resources out there, school-based toolkits through SAMHSA and other resources that you can look at to have a conversation with your child. And it's never too early to talk to your kids about information related to drugs and addiction. Knowledge is power, and talking to kids and giving them your vantage point, and if you have trouble finding the words, there are resources that can assist you with those words, but that's very important. We've also worked with Catholic Charities as well, and it's our building that, before COVID, we would have the training around naloxone, and I think there was a press conference earlier in the year that I brought my kit with me, and Unfortunately, I don't have it today, but naloxone is a life-saving medication that you can administer to someone who's in the throes of an opioid overdose and potentially save their lives. And it is a very easy thing to utilize. It is just a spray up the nose, and if the person has another condition going on, it is not something you're going to hurt them with. So this is an important thing for people to be aware of, and if you have someone that you are concerned about in your family and friends, I urge you to get this training and to have this available to you. It does not substitute for calling 911 or getting medical attention, but it can buy time while you're waiting for those resources to be available. As Dr. Giordano indicated, medication-assisted therapy is very important, and we had early on partnered with the MATTERS initiative, which is medication-assisted treatment and rapid response. Some of you may remember County Executive McCoy, Dr. Giordano, and I invited Dr. Josh Lynch, who is from Buffalo, where this was conceived and has had great success, here to discuss this with our treatment partners last year. And we have seen an uptick of utilization of medication-assisted therapy right in the emergency room, which is important to utilize that time period when people are there to refer them to treatment and to provide them with the medication that they need to get better. So, and a final thing that I want to talk a little bit about is we do talk about prescription drugs. And prescription opioids are frequently a gateway for people to start taking opioid-related medications and become addicted. So though we know the prescribing has been significantly decreased in the past few years as a result of provider education, mandated training in New York State of providers, there still are people that have those medicines in their medicine cabinet at home, and we urge you to dispose of those before they fall into the wrong hands. So, we had originally, there's a load of different ways that you can do this. We had worked with several local pharmacies to have take-backs, and there are routine drug take-backs, but knowing that these medications should not be shared, need to be taken as directed, and shouldn't be stored for long periods of time is another very important preventive mechanism. We look forward to continued collaboration. I do think that this effort does take multiple agencies and partners to succeed. We have worked with regional EMS, our hospitals, emergency rooms, the care providers, Department of Mental Health. There are many partners that have been very dedicated to this work, and we look forward to continuing this in the future.
Thank you, Liza and G, obviously for your compassions for both your departments, but what you do continuous 7 days a week around the county for everyone. So I appreciate that. And again, I just want to remind people out there, people struggle, even though they're in recovery. Setbacks happen, and you have to be there for them, and you have to be there to catch them. You have to be there to understand, and you gotta totally understand. Just because it's 20 years later, like my one brother Kevin, it's 22 years almost, and still there's times you get them struggles, and my brother Brian's 12, and you get that, and it's gonna happen. But you have to be there for them, and you have to understand. And I always, joke around with them. That's why I always say, keep the chains moving and plug in a jug, and you'll get through this. And use a network of your organizations. Reach out to different groups. Reach out to friends and to the families out there. We understand the struggles you're going through, and we can get through this being there for each other. So continue that going on. Also, we do have the mental health hotline available, as always. It's been going since March 13th. Thank you, Dr. G, and your staff there. It's 7 days a week from 8 a.m. to 5 p.m., 518-269-6634, 518-269-6634. And our 24-hour sexual assault hotline number, as always, 518-447-7716. And our great partnership with United Way, with Pete Gannon, 211, and the New York State hotline, 1-888-364-3065.